Hi, I'm Dr. Yvette Lu. I'm a family physician. In this video, we're going to talk about how to decide what activities you should and shouldn't do during the pandemic. As we open up, I've noticed a lot of questions and confusion about what's okay to do and what's not okay to do, what you should do and what you shouldn't do. And I think people just want to be told, or they want clear, simple answers about what's safe and what's not safe. Unfortunately, simple answers aren't possible because it depends on what risk level you're willing to accept. So I like to think of this in two parts: your personal risk level and the risk level of the people who are close to you, and the risk level of the environment or the activity that you're going to be taking part in. So let's look at personal risk first. So if you are of older age or have a chronic medical condition that is associated with adverse outcome in COVID-19 infection, then you are at higher risk. If you are immunosuppressed or if you are undergoing cancer treatment, then you'll be at higher risk. If you have close family members who have any of those things that I previously mentioned, like they're of older age, have chronic conditions, or immunosuppressed, then they're at higher risk. And when you're assessing your risk, your personal risk, you should consider yourself at higher risk as well because you are in close contact with them. If you're social distancing from those people and you can stay 2 meters apart from them at all times, then you don't need to consider their risk level in your personal risk calculation. But if you are in close contact, like you're driving them places and you're living in the same household as them, then you should consider yourself the same risk level that they are at, because you'll be so close to them that you could transmit something to them. So that's your personal risk level. So you want to classify yourself as low risk, medium risk, or high risk. Next, you want to look at the type of activity that you'll be doing when you go outside your home. So a great phrase that I have heard of is, I will give credit to Dr. William Miller, an epidemiologist at Ohio State University. And the phrase is time, space, people, and place. Time, space, people, and place. So we know that COVID-19 spreads best and most effectively when people are in close contact for prolonged periods of time. So that's the time and space part of the equation. So examples of situations in which you're in close contact for prolonged periods would be like going to the hairdresser, going to get massage therapy, going to get a tattoo, going to get your nails done. All these activities require you to be close to someone within 6 feet or 2 meters of someone for an extended period of time. So those activities will all be high risk. You're spending a long time with them and you're in a small space. So when you're assessing an activity, look at how long you'll be spending with someone and how close you will be to them. And if you're spending a long time, you're close to them, then that is considered a higher risk activity. The next part of the equation is people. So when there are a lot of people around, then there will be a higher chance of transmission of COVID-19. So crowded areas will be higher risk than less crowded areas. For example, if you go to a mall, you want to go shopping, go to a mall or a store, and it's very crowded, then that will be a higher risk environment. If you go to a beach and it's empty, that will be a lower risk environment. And then the last thing is place. So we know that indoor places are higher risk than outdoor places. So if you want to have lower risk activities, you want to stick to outdoor activities. Any kind of indoor activity like eating indoors at a restaurant, even if it's socially distanced, will be higher risk because of the circulation of air. In fact, there has been a study in which there was a restaurant with a closed environment, and due to the way the air was circulating in the restaurant, several people caught COVID from a different patron in the restaurant. So if you're in a restaurant, it's best if you either sit outside on the patio, or if the door is open, then we know that that will help the air circulate more freely in the restaurant, and it'll be less likely to result in COVID-19 infection in the patrons of the restaurant. The other thing about place is that locations can modify their risk based on what kind of precautions they're taking. So if you're at a restaurant or visiting a business, often they will have their safety guidelines posted either on their website or You can ask them what kind of safety precautions they're taking, and if they're doing regular cleaning, practicing social distancing, if their staff are all practicing social and physical distancing, then those are ways that restaurants and businesses can reduce the risk to their patrons and customers. Once again, the 4 variables are time, space, people, place. For a low-risk activity, you want to be spending less time with someone in a larger space, so you want to be more distanced from them, in a less crowded environment, so with less people around, and you want to be in an outdoor space. That will be low risk. For higher risk activities, these will be activities where you're spending a lot of time with someone in a closer, confined space, in a crowded environment where there are more people, and in an indoor place. So those types of activities are higher risk. When you're doing your overall risk assessment, you want to look at your personal risk and your environmental risk. If you're low risk personally, then you can probably engage in higher risk activities if you're willing to accept the risk level. We know that some people who are low risk can have serious COVID-19 infections, but if you're willing to take that personal risk, then maybe you can engage in some of the higher risk activities. If you're not willing to take that personal risk, even if you're low risk, then stick with the lower risk activities. If your personal risk level is high, then you want to stay away from high risk activities and only stick with the low risk environmentally, the low risk activities and the low risk environments. I know, it's complicated, but just remember that phrase, time, space, people, place, and apply that to all your activities, and it will become much clearer and much easier with practice. And I think we are going to have practice at this for at least the next few months. I'm Dr. Yvette Lu. I'll see you next time.